Hello, and welcome to today's Pedestrian and Bicycle Information Center and American Public Health Association webinar. Today's webinar is titled Prescription Trails, How Public Health Officials Are Supporting Trails and Walking Programs, and we will be speaking with Attila Baladi with the Rivers, Trails, and Conservation Assistance Program in the National Park Service's New Mexico office, Dr. Linda McDonald, a physician in Albuquerque, New Mexico, and member of the Prescription Trails Steering Committee, Russ Hirschler, the Executive Director of the Upper Valley Trails Alliance in Vermont, Becky Lewandowski, the Upper Valley Trails Alliance's Program Coordinator, and Judy Corwin, Administrative Director of Marketing and Public Relations at the Corvallis Clinic in Oregon.
So my name is Attila Baladi with the National Park Service Rivers, Trails, and Conservation Assistance Program in the New Mexico Field Office, and I'm going to do a little presentation on New Mexico prescription trails. And our presentation is two parts. First is an overview of the development of the New Mexico Prescription Trails Program. And second, with Dr. McDonald, a physician's perspective on this program in New Mexico. I'm going to want to discuss the research behind our New Mexico Prescription Trails, how our program developed and how it's continuing, some specifics on our project tools, and then finally how to implement in your community. So we had a couple of project goals and training goals. One was to help patients adopt regular walking as a lifelong activity, particularly in areas close to their homes and their neighborhoods, and then to prepare healthcare providers to implement the project. And we'll touch on those more and what we're finding on that. Our goals were to initiate dialogue between Parks and Recreation and healthcare practitioners. We early on recognized the disconnect between healthcare practitioners and Parks and Recreation providers, not really talking, planning together, working well, and we thought this might be a good venue to bring the two professions together to think how they can collaborate on a mutual project. We also wanted to recognize the value of parks, trails, and open space, infrastructure, and overall community health. So 5 or 6 years ago, we were already thinking about how can we market this better? How can we get a different user to city parks in Albuquerque? And then advance local policy regarding walkability park improvements in the local areas. So the goal here is to help patients adopt regular walking. We're encouraging healthcare providers to offer walking prescriptions for patients, but it is a very measurable way we're doing it here in town. And we also have training for physicians on how to use the program and how to prescribe physical activity, which we're finding is one of our most difficult challenges. So quickly on the research, before we got started, we kind of jumped into this by looking at 6 other models from the U.S., New Zealand, and Canada that connect walking to wellness. We compiled and reviewed over 20 articles on walking, exercise programs, and motivational engagement. A lot of that research is starting to come through Active Living Research and other organizations that were starting on this front. So those informed and set up our prescription walking program in Albuquerque, and then we added clinical components to add concepts of chronic disease into the mix as well. Our Albuquerque pilot, before we actually went off and got the program moving, we work with 2 sites. First Choice Community Health Care, a primarily underserved, uninsured population, and Albuquerque Health Partners, which is one of the larger HMO-type providers. And First Choice is also tied in with the National Association of Community Health Care Centers, and we thought that was a good mix. We created a Spanish and English version of the prescription pad and a walking guide, which we'll talk about more in a bit, and tested in 3 medical clinics for a 6-week period. And the focus of an evaluation was to assess the feasibility of the prescription tool from a healthcare provider's perspective. And then the idea and the concept we kept pushing here was that if we're ill, our physicians give us prescription for whatever medicine to treat our illness or antibiotic. We're rushing off to Walgreens or CVS in minutes to get it filled. But the compliance for recommended physical activity seemed to be a little bit less. We were testing this idea, would people be more compliant if they were given a prescription for walking and asked and told where to go. The results showed that it was feasible to idea this and test it further and go for it. We had recommendations around the revision of the training, guide, and prescription pad were all implemented, and then we started the program. Since then, it's expanded in several other places. It's now in southern New Mexico in several locations, in Santa Fe, and several locations weren't found to be feasible because of the lack of resources they had. I want to kind of touch a little bit on the project overview for Albuquerque itself and how it came together. Began as a collaborative effort in 2006. It came through the Albuquerque Alliance for Active Living, which was one of the communities that was being supported by Active Living by Design, the Robert Wood Johnson Foundation program, partnered with the Park Service Rivers and Trails program, and also partnered with the New Mexico Healthcare It Takes on Diabetes Coalition to build a collaborative approach to this. So I brought this to our local community after hearing Dr. Charlie Brackett from the Upper Valley Trails Alliance at several Active Living by Design conferences talking about prescription trails initiative there, and thought that would be a good model for Albuquerque to test. So I think a lot of our credit is due to what the Upper Valley folks have accomplished there as well. So we brought in Bernalillo County Open Space. We brought in the City of Albuquerque Parks and Recreation, GIS mapping from the City Planning Department, New Mexico State Parks. We brought in the New Mexico Department of Health, Clinical Prevention Initiative, a PRISM evaluation, a healthcare evaluation team, and the health plan, the major health plans in the city all sat at the table as we developed our program. In Santa Fe, there was environment-related groups, the Transit Department, New Mexico Department of Transportation, Human Resources for the city, and otherwise, and they all kind of developed similar tools. So one of the big ideas is that prescription trails is local, and we were developing these walking guides. The Albuquerque Walking Guide created initially 37 locations that seemed to fit the bill for us. Trails that were evaluated, and I'll talk about these grades a little bit later on here. They were evaluated to serve the population. They were found to be meet most of the ADA guidelines or other guidelines regarding accessibility and trails and paths. And we went with our approach was 3 park loops within every zip code. And Albuquerque being a very older part of the city's very grid-oriented development, there was easily accomplished the 3 trails and 3 parks in each zip code. And we looked at these statistics and how we came up with this. We also did a gap analysis and find out where we had some lacking of resources to work with. So our first guide had 37 trails. They're all mapped in a very similar format with information about how to get there, transit available to it, how far each loop was, whether it was handicap accessible or not. Primary ones were. We also created a website that had them listed by zip code. So throughout City of Albuquerque's Parks and Recreation website, we found and set up this with the initial Prescription Trails website. So those 2 tools available for physicians, and we also went with our prescription pad. And I think what is still kind of unique about this one is that we are targeting certain routes, certain distances, so it's easier for a physician to, say, go walk at Snow Heights Park for 20 minutes. It's a quarter-mile loop, and if you 4 loops for a mile, those are all measured and marked at each park. You can follow up with this. Now, our problem still is that it's still hard to evaluate the patient's views of the park, which I will cover a bit as well. But this was tested several times and revised with these graphics at the request of the physicians groups we were working with. And moving on, adapting the project to your site. It's most important, I think, we need to appoint a site coordinator. So whether that's someone from the health community or Parks and Rec community or otherwise, someone to coordinate and put together a prescription drugs program for the community. That's kind of the first part. Look at coordinate training for new providers as needed. And that's a big part of it, is how providers can get the training and implement the programs. And that's still the challenges we face in Albuquerque and other parts of the state. How do you print prescription and walking guides? How do you tie those together to make sure they are one package and not just a walking guide that anyone can pick up? Participate in evaluations. And the research that we're finding out is still, how do we get physicians comfortable in prescribing physical activity, and then the continuing follow-up and follow-through with the program. In Albuquerque or New Mexico, there is a statewide steering committee now that meets on a regular basis to look at some of the statewide issues and challenges we face as we try to implement the program. So come to the steps for us. What infrastructure exists in the community? Some of the examples in New Mexico, they've been done by zip codes, they've been done by neighborhoods, they've been done by city council districts. Kind of depends on the layout of the city and what works best for that local area. Who should be on the implementation evaluation team? One of the things we found in ours is that we wanted to bring in physical therapists into our evaluation team. So we're out evaluating the different trail environments and park environments for the physical activity. We're bringing physical therapists in to help assess the resources, and is it suitable for all the populations. In Albuquerque's test model, our population base was those who are the least active, those who have trouble walking to their mailboxes. So our targeting was trails that were never longer than a quarter-mile loop. We hope to keep near resources like city parks or city senior centers or fire stations where there was help nearby. That's identified in most of our maps. And then we also wanted to keep it so you could easily get there from your home without driving, take advantage of transit or other transportation to get to the park, or even just walking to the park. What's our funding source? How do you work with the state programs, DOH, and other grants to keep it moving? We now have, in ours, we have some of the health plans now sponsoring park improvements for the trails to keep them improving. How do you evaluate the program? Several pieces of evaluation include, one, are the prescriptions working? Two, are the patients benefiting from that, which is a harder piece for Parks and Rec folks to deal with? And three, are people more aware of parks and recreation opportunities in their city or the community as a result of this program? And then what's the long-term maintenance or improvements of the trails? Our goal is not to go in and create and build new trails, is to use existing resources, existing loops, existing paths, but keep them, maintain them from cracks or breaks or damage or vandalism nearby. So we had an evaluation form that's been pretty well accepted and adopted now. It doesn't go to the whole level of the National Center for Accessibility, but it kind of took their concepts and accessibility concepts and looked at this idea. We train volunteers to go out and assess new opportunities. We just revised our guidebook from 2009 and gone from 37 trails to, I think, about 70 loops, I think, or so in there now, as we've found more resources. So we're looking at things like the path width, 4-foot minimum. The wider the better, since we're social and like to walk with people next to us. Single file doesn't work. Less than 5% grades. Cross slope issues. So we're not looking at physically inactive, but we're looking for patients who might have gone through some recent surgery that might require physical activity, and the doctor has to be comfortable knowing that the route they're prescribing is not going to cause any adverse health effects of the patient. So grade 1 was our accessibility to all users, flat paved pathway located around our park, suitable for wheelchairs, mobility impaired. Grade 2 might have had some crushed or fine or other less stable surface. And there's also very minor grade changes. And then grade 3 was slightly challenging that might go to a paved, packed, crushed, refined, or dirt pathway. But the idea was that we kept people in town and didn't send them off to the National Forest Trails or the City Open Space Trails or Petroglyph National Monument Trails, which are more challenging. We wanted to keep it close by and reference people to other resources. So our Prescription Trail Steering Committee provides technical assistance to new organizations and new projects that are forming up. We've copyrighted the logo so it's standardized across the state. We are looking at consistent messaging, reviewing materials that other communities put forward to us. We're helping provide materials and masters for printing for exam room posters, press releases, exertion charts, decision point messaging, implementation binders of the forms that the physicians can use and communities can use, and then provider training presentations to the different groups we work with. And we rely on our local partners to coordinate that. And we are doing site visits and traveling to help some of these groups and go statewide with the program. So in your community, the expansion opportunities, we're looking at simple modifications to trail resources or park resources. We're not looking at creating new trails everywhere. However, as I mentioned earlier, one of our goals is the policy changes. So as new parks come online or old parks are torn up and redone, we are working on planning policy to consider loop routes around those facilities that meet the minimum standards that we've set up for our program. And that's starting to occur with the city. It is engaging the healthcare community. We are still talking in Albuquerque about having a physician serve on the Albuquerque Parks and Recreation Advisory Board, both to help them think about the health impacts or health opportunities of programming and new opportunities in city parks. It's a low, no-cost type program for the parks if the resources are all in effect and they're doing regular maintenance on that. And it does enable us to enlist community volunteers for both evaluation, marking the trails. We're working on the packaging to have all the trails marked with medallions on the ground level to at every 1/10 of a mile to allow people to know how far they've walked for that population that prefers that technique. So wrapping up, we're in about the 5th year of our program. We have good participation still from healthcare community and also from the Parks and Rec programs as we go across the state. We're solidifying that. We're still working on evaluation ideas. We're still looking at how do we ramp up our physician training and then recognize we have to deal with the ability to help physicians understand how to prescribe physical activity for the program. Okay, at this point, I'm going to turn it over to Dr. McDonald and let her cover how the physicians are implementing the program in New Mexico.
Thanks, Attila.
You're welcome.
James, do I have the screen up properly?
No, you're going to want to put it in slideshow form. That works. That was great. Thank you.
Okay. So thanks for inviting me, and good afternoon. I'm going to talk about the relationship between physical activity and overall health. And I'd like to start with a quote from the Center for Disease Control. And they say, given the numerous health benefits of physical activity, the hazards of being inactive are clear. Physical inactivity is a serious nationwide problem. Its scope poses a public health challenge for reducing the national burden of unnecessary illness and premature death. And as a primary care provider, internal medicine physician, I see numerous people with chronic medical illnesses related to inactivity and obesity. And I think this is really a major problem that needs to be addressed. And so that's what I'll be focusing on today. There we go. So I'm going to go over the benefits of regular physical activity. And you can see that this is a very long list. Despite how long it is, I am going to go through the whole thing. I think it's important for us to realize that there are just huge benefits to being physically active. So regular physical activity increases the chance of living a longer and healthier life, decreases the risk of hypertension and dyslipidemia, which is abnormal cholesterol, decreases the risk of heart disease and stroke, decreases the risk of colon and breast cancer and possibly lung and endometrial cancer, helps prevent type 2 diabetes and metabolic syndrome, helps prevent osteoporosis, decreases the risk of falling in older adults, improves cognitive function in older adults, relieves symptoms of depression and anxiety and improves mood, prevents weight gain, promotes weight loss, and helps keep weight off after weight loss, improves heart, lung, and muscle fitness, and improves sleep. And there are actually more benefits, but I ran out of room on the slide. And if you look at these, there is really no single drug medication out there that has the numerous benefits that regular physical activity has. The benefits occur for people who are currently healthy, for people who are at risk for chronic diseases, for people who already have chronic disease, for people with disabilities, for old people, for young people, for people who have never exercised. Everybody. Benefits of physical activity far outweigh the possibility of adverse outcomes. So when we're talking about physical activity to promote and improve health, we're really talking about moderate intensity physical activity. And the moderate intensity physical activity needs to be done for at least 150 minutes per week or 30 minutes 5 times a week. Moderate intensity physical activity causes only light sweating or a slight or moderate increase in breathing or heart rate. So it's really not an uncomfortable level of activity. Walking at a pace of 15 to 20 minutes per mile is moderate intensity physical activity. Biking at a pace of 6 minutes per mile, shooting baskets, raking leaves, water aerobics, and certainly a host of other things. But keep in mind this is not strenuous activity. It's also not strolling slowly around the block, but just a moderate pace. There's abundant data supporting the health benefits of physical activity, and I'm going to show you just a little bit of data. If I had more time, I could show you lots more, but we don't have a lot of time, so I'm just going to show you a few things here. So this looks at cumulative survival by exercise capacity. And the researchers who did this study looked at two groups, men aged 60 or less and men over age 60. And what they're showing here in these two graphs are cumulative survival, 100% surviving at time 0 when they started the study, and then the number of surviving in this group, the 60 or less, at about 22 years, and in the 60 and above group at about 20 years. And they're comparing rates for different levels of fitness. So the less than or equal to 6 METs, METs is metabolic equivalent, and it's just a way of comparing different activities or levels of fitness. Were men who had very low fitness, 6.1 to 8 METs were men who had low fitness, 8.1 to 10 METs, moderate fitness, and greater than 10 METs, high fitness. And you can see that survival over time was much lower for the men with the very low fitness than it was for the men with the high fitness. And this was seen in men who were age 60 or less and the men over age 60. Obviously, there were some older men with chronic diseases and things who the death rates were higher in the older age group, as would be expected. But again, a very statistically significant difference between the high fitness and the very low fitness, and even between the high and the low fitness in both groups. This study looked at risk of coronary heart disease, that's the kind of heart disease that causes heart attack, by physical activity and aerobic capacity, or fitness level. And we have physical activity in the green bar and aerobic capacity, or the yellow bars. And they divided the group into 5 quintiles. So the least fit are the 0 percentile, the most fit, the most active, the 100 percentile. They set the relative risk of coronary heart disease at 1 for those who are least fit, the yellow bar, and least physically active. And they looked at the drop in risk in the groups that were more physically active and more fit. And you can see that, especially for fitness, there's a huge drop in risk between the least fit group and the next least fit group. There's also a drop as physical activity level increases. So you can see, again, that with increases in physical activity, increases in fitness, risk of heart disease drops significantly. Here's a study that I liked. It looked at walking time and TV time and risk of obesity of diabetes. And this study showed that for each 1 hour per day increase in brisk walking is associated with a 24% reduction in risk of obesity and a 34% reduction in risk of diabetes. Each 2 hour per day increase in TV time was associated with a 23% increase in risk for obesity and a 14% increase in diabetes. So turn off the TV and get out there and walk. And then finally, this looks at cost of health care. And this is per member per year subscriber eligible amount for levels of physical activity. And so these costs are what were paid by the insurance company and by the prescriber. So these are the amounts in dollars. So these are the daily exercises. Average cost per year was about $3,500. Not a significant difference between the daily exercisers and those who exercise 5 to 6 times per week. But as we drop down to 1 to 4 times per week and to sedentary people, there's a significant increase in cost. So many, many benefits from regular physical activity. However, despite the known health benefits and cost benefits of regular physical activity and the availability of clear guidelines for physical activity, the majority of adults did not get sufficient physical activity for health benefits. In 2010, about 21% of adults met physical activity guidelines, and about 33% of adults reported no aerobic leisure time activity at all. They're pretty appalling numbers. So can we apply the public health perspective to improving levels of physical activity in order to improve health? We know that public health interventions have been used successfully to reduce the prevalence of infectious diseases and to reduce the prevalence of smoking and other things. Can we use similar interventions to reduce the prevalence of inactivity, overweight, obesity, and chronic diseases? So this slide was taken from the Institute of Medicine website. And the Institute of Medicine has really been targeting obesity recently. And they have a large report, Accelerating Progress in Obesity Prevention, that was published this year that has just a wealth of great information and great ideas. And they've identified 5 essential areas that need improvement. I'm focusing here on physical activity, but I did list the other 4 below here. So they note that Americans have become more reliant on cars, and walking and biking have decreased. And if we look at data from 1977 compared to 2008, in 1977, about 4.1% of individuals walked to work, down to 2.8 in 2008. School children walking to school, 20.2% in 1977, down to 12.5% in 2001. And they report that 19% of Americans get the recommended amount of physical activity. The data that I showed you on the prior slide, the 21% is actually newer data that was just published recently. So it looks like there's been a slight increase in the number of Americans getting the recommended amount of physical activity. So the Institute of Medicine has 5 solutions, each one targeted at one of the areas that they've identified. For exercise, physical activity, they're recommending that we integrate physical activity every day in every way. They recommend that communities, transportation officials, community planners, health professionals, and governments should make promotion of physical activity a priority by substantially increasing access to places and opportunities for such activity. So how can we do that? One way is to promote walking, and walking is just a great way to integrate physical activity. It does not require specific skills or equipment. It can be done indoors or outdoors. There's a low risk of injury. Brisk walking, as I showed you before, does provide health benefits, and benefits accrue with short bouts as long as the total accrued is at least 150 minutes per week. So you could walk, as I said before, 10 minutes 3 times a day and still get your 150 minutes. 3 times a day, 5 days a week, and get your 150 minutes per week. So I'm going to talk a bit about barriers to walking. We'll start with environmental barriers, and then we'll talk about personal barriers. So this was a study that was done. It was a telephone survey of over 10,000 people across the country. And they asked people how much walking they did, and then they went over different barriers to walking. The never walker group are people who walk for less than 10 minutes per day for exercise. The regular walkers are those who meet the criteria of 150 minutes of brisk walking per week, and the occasional walkers are those who fall in between. And I took the data that they had presented and just ranked the reasons, the environmental barriers per walking by group. And you can see that the first two reasons were the same for each group. Number one, no walk jog trails, and number two, don't see other people exercising in my neighborhood. Although these are the same, there was a statistically significant difference between the regular walkers and the never walkers. Far more never walkers stated that there were no walk jog trails in their neighborhood compared to regular walkers. Same thing with the don't see other people exercising in the neighborhood. This was a far more common response in the never walkers compared to the regular walkers. There were no differences, statistically speaking, between the occasional walkers and regular walkers and between occasional walkers and never walkers. And then you can see other reasons. Unattended dogs was listed on all three. Heavy traffic for the never walkers and occasional walkers. No sidewalks for the never walkers. And then hills were a problem for the occasional and regular walkers. So how can we address environmental barriers? This is one place where prescription trails come in. And as Attila showed you, there are prescription trails walking guides, which are available either as a booklet or online. And they identify walking and wheelchair rolling routes that are both safe and accessible to patients and families. There's also a prescription pad that healthcare practitioners can use to allow them to write tailored prescriptions for their patients. And this is another one of the pictures of the trails. Attila showed you one in his presentation. So these are all outdoor trails located in parks. They are located in every zip code, as Attila said. And the information provided includes trail rating and distance, location, availability of public transportation, parking, amenities such as playgrounds, picnic tables, benches, and public facilities. Why the park? Why are we recommending that people walk in the park? Well, there's actually a fair amount of research looking at green exercise or exercise in nature. And some of this data shows that green exercise results in a greater improvement in blood pressure, self-esteem, and mood compared to exercise without exposure to nature. Now, exercise in general improves blood pressure, self-esteem, and mood, but there is a greater improvement if people are exercising outside. Another study looked at walkers, and they took the same group of people and had them walk in a park environment or in an urban environment, and they found that people who walked in parks were more likely to walk longer and to walk at a moderate to vigorous pace compared to the urban walkers walking for the same duration. Okay, on to the prescription. Get up and get moving. So patients are more likely to begin and continue a regular walking program when provided with a prescription by a medical practitioner. I personally really like to be able to hand my patients something that has the importance attached to it that a prescription for a medication has. I think it really emphasizes that I think this is important. I think it's part of the medical treatment, and it's something that I expect them to do. So the prescription for health allows the practitioner to tailor the exercise prescription to the patient's abilities and to recommend a gradual increase in exercise duration and frequency. And you can see here it tells people to start with a certain number of minutes, a certain number of days per week, and gradually, I like the word gradually, increase to a certain number of minutes and probably more days per week. And then the prescription trails booklet or going online allows us to look up the patient's zip code, or let's say I have a parent who's neighborhood, I can look up the zip code in that neighborhood, and we can find a park nearby where the parent can walk. Okay, let's move on and talk about personal barriers to walking. So again, we have the same group, the never walkers, the occasional walkers, and the regular walkers. And you can see the never walkers and the occasional walkers both listed no time as the first reason. I had to add a number 6 here because no time came in as the sixth reason for the regular walkers. And this was a statistically significant difference between both the never walkers and the occasional walkers and the regular walkers. Too tired, not enough energy was also significantly more often reported by the never walkers and the occasional walkers compared to the regular walkers. So addressing these barriers, making time for exercise is a big one, and I hear this very, very frequently that there's no time. And I think people end up feeling like they have more time and exercise is not so onerous from a time standpoint when they can focus on short bouts. And again, 10 minutes 3 times per day, 5 days a week adds up to that 150 minutes per week. And I tell people, you're not going to train for a marathon in 10 minutes 3 times per day, but at least you do get some health benefits from doing that. I've also found that once people get into the habit of regular exercise, their 10 minutes often becomes 15, 20, or even 30, and they're doing a lot more exercise than they started off doing. Finding an accessible place for exercise near home or work is also important. If people are having to drive half an hour to the gym or drive 40 minutes to get to a park or a trail where they can walk, they're far less likely to do it. Using commute time for exercise, I think, is a great way to fit in exercise. People can walk or bike to work. I see a couple people who take the bus to work, and if they have time on the way to work, they may get off a few stops early. I see one man who gets off halfway home at the end of the day and walks almost an hour to get home, and that's his way of getting exercise. Exercise instead of watching TV. Many people who tell me they don't have time to exercise, I ask how much time they spend watching TV, and I often hear 2 to 3 hours. So that's something where people can certainly take some of that time and use it for exercise. And then finding energy for exercise. I also hear from a lot of people that they're just exhausted by the end of the day, and they really don't have the energy to get up and do something different. Again, exercise in short bouts can help with that. If you're feeling tired, tell yourself, I only have to do 10 minutes. Or fitting it in earlier in the day before you get tired is a great strategy. Also, starting slowly and gradually building up duration and intensity can help with people who have fatigue issues. And the other thing that I remind my patients frequently is oftentimes we're mentally tired at the end of the day, and we may be physically tired from sitting in one position at our computers all day long, and getting up and exercising can actually be invigorating and help us feel better. So in summary, physical inactivity is a public health problem. Promotion of walking for physical activity or exercise can address this problem, and barriers such as lack of walking trails, lack of time, and lack of energy must be addressed. That's it. Thank you. So I'm going on, I believe, to Russell next. See if I can.
Thank you, Attila and Linda, for leading the way so that Becky and I can speak about programs that create healthy communities. Once again, we're from the Upper Valley Trails Alliance. We're speaking to you from Norwich, Vermont, which is right on the border with New Hampshire, near where Dartmouth College is. So the Upper Valley Trails Alliance is a slightly different organization than the first two presenters that you heard earlier. We're a nonprofit organization. We've been around for coming on 13 years. We were founded in a very grassroots way in that there are lots of small recreational trails in a number of different communities in our region. And we have some pretty small towns ranging in size from 800 residents to close to 9,000 or 10,000 residents in some of the larger towns in our region. And there was a push back in 1999 to create an organization that would offer support to a lot of the smaller organizations and trail groups that are out there. So you can see within our mission that we advocate for the maintenance, use, and development of trails. And we do education programs, outreach programs, and stewardship programs, primarily leading to connecting people to the trails, and this leading a coalition of trail groups, and of course promoting active lifestyles. And one of the unique things about our region is that we typically have a very long winter. Winter sets in sometime around now and lasts, depending on how much snow we get, through till April or May. So really promoting physical activity in all 4 seasons is a very important aspect to the work that we do. We have a long-range vision about integrating the Upper Valley Trail System and having it be accessible to all residents in the region. And we have a major focus on developing infrastructure in our community. And you'll see as the slides go on, again, we work in about a 40-town region, and each of these towns and communities has their own separate town government, Most of them have their own separate school districts, their own town budgets, their own town departments. So thinking about supporting towns, residents, and other organizations within these diverse 40 communities is really what our long-term vision is. And the connectivity piece is key. In a bi-state area, we're the only organization that's taking a regional approach to trails. And especially when we have 2 states in the region, trying to at least facilitate not only trail connections, but communications across those states and communities is a very important aspect of the work that we do. So again, this gives you a little bit of an understanding of where we're physically located. Again, we work in 40-plus towns in the region, ranging from very small, 800 to 1,000 residents, to close to 10,000 residents. Most of the land here is privately held. Even the national forests, the Green Mountain National Forest and the White Mountain National Forest in Vermont and New Hampshire are accessible, but over an hour away from where the primary population areas are in this region. So we're quite rural. We're very car dependent, and we also have limited bike and trail and pedestrian facilities in place. This is a visual that many of you have probably seen before and touches a bit on what Linda was explaining about the prevalence of obesity in our country. And I always like to use this one just because graphic color changes are so jarring that really in a 20-year period, the obesity trends in this country have nearly doubled. A little bit more specific to the region, the Upper Valley region. Of the 6 New England states, New Hampshire has the highest level of adult obesity. And as we know, the data also trends towards children, where 30 to 35% of children are considered overweight or obese. And the Trails Alliance has a pretty close partnership with the Dartmouth-Hitchcock Medical Center, which is a larger medical institution that's associated with Dartmouth Medical School and Dartmouth College here in the region. And working with the pediatrics clinics and some of the clinics in the, I would say, the less affluent areas in the region show that the obesity levels or overweight and obesity levels for children in our region it's higher than the New Hampshire data and other national data shows. And really, this is just trying to reinforce the fact that, again, we are quite rural and that there's a lot of regional divide between the haves and the have-nots in terms of financial resources, everything from some communities that have more accessible trail infrastructure as compared to other communities that have almost zero public trail infrastructure, or access to even a grocery store or healthy foods. There are a number of families that live in towns and communities in the Upper Valley region where the nearest fresh food is over 30 minutes away. So a lot of these working families are picking up unhealthy frozen foods at the corner gas station and bringing them home for their kids to eat. So we have a lack of access to high-quality foods or healthy foods or fresh foods, and a lack of access to trails and infrastructure to become more physically active. So yes, you heard a little bit about this through Linda's presentation, that the recent study shows that outdoor physical activity greatly improves mood, self-esteem, mental health. My joke is when I talk to people around the community and I share this information, I tell them that if their colleagues are in a bad mood, they should just send them outside for a quick 5-minute walk. In addition to the other reasons that Linda mentioned in terms of why physical activity is good for health, adding to reductions in heart disease and certain types of cancer and diabetes, trails and outdoor accessible areas are open year-round, and there's most of the time no cost. So I always have to put in some kind of fundraising pitch for our nonprofit work here at the Trails Alliance. And of course, trails and accessible opportunities to be physically active outdoors have a major impact on the individual and community health in our region and any of the regions where any of our attendees are listening from. There's also an additional piece. When communities are, when public health professionals are working with families, and again, this has a lot of focus on, you'll see the future slides in our presentation will have a little bit more of a focus on children, that kids that are more physically active and physically fit tend to do better in schools. And there's a lot of data that supports that. And that those students who are getting to go do physical activity outside and are healthier have a tendency to do better than their classmates who are less active and who are getting less outdoor recreation time. There's other data that I did not put on this slide, which also shows that healthier kids have a tendency to be absent less. So physical activity, especially in the outdoors, leads to a decrease in absenteeism in schools, which then helps create a positive feedback loop for academic achievement. So essentially, get kids to get outside, get them more physically active, they do better in school, they want to be there more, they miss less school, and we're starting to build lifelong behavior changes as time goes on. It's been mentioned in the other presentations and slides before ours that a lack of access to for outdoor physical activity is cited as a primary reason why people don't get outside. Because of the nature of our rural area, it's not like we have tons of municipal parks or county parks. Most of the goings-on take place either at someone's workplace or within their own community and the schools that those kids attend. So really looking to develop trails in village centers and near the schools provides easy access to outdoor learning and physical activity. Again, that's where the majority of the population in each of these communities centers their lives. So helping to develop those trails, some of the work that the Trails Alliance does, has a tendency to have a positive impact on community health. As was mentioned again from Attila, with Active Living by Design, the Upper Valley Trails Alliance was selected as an Active Living by Design community in 2002. Of 900 applicants, 25 communities were chosen, and the Trails Alliance was one of them. We created a Trails for Life partnership, which was really trying to take a look at how do we develop policy and physical infrastructure change within the 4 core primary towns in the Upper Valley region. That's where the majority of people work and the majority of where people live. But we were one of the only Active Living by Design communities that was in a rural setting. It did have a tendency to make things somewhat more difficult for us as we moved on. So some of the issues that came up with being an Active Living by Design community for us were that how did a trails organization become a health organization? And because we are a small organization and currently we only have 3 staff, when the Active Living by Design grant was brought to the Upper Valley, there was only 1 staff member. So we really had a limited capacity to implement the change that we wanted. So there was some community criticism that the Trails Alliance was focusing the majority of our resources on health programs instead of getting trails on the ground. So in 2007, 2008, when the Active Living by Design program ended, we took the most successful programs that we had developed under Active Living by Design, kept them in place, and refined them. So some of the, we'll talk more about the Passport to Winter Fun, which has some similarities to the Prescription Trails program, but much more focused on kids in schools. And then we developed a series of events where we focused on biking and walking to work and school. We developed a program called the Tour de Taste, which is a progressive pedaling picnic that's designed to get families and community residents of all ages and all physical ability levels to get out and eat healthy, locally grown foods and get on their bikes and ride. And then we also encourage 4-season use through, we developed the longest skating trail in the United States on one of our, hopefully, frozen ponds this coming winter. Up on Lake Maury in Fairleigh, Vermont is a publicly accessible outdoor skating trail that's 4 miles long. So again, we really looked and kept what was the most successful and let the other programs sort of go by the wayside to manage our resources as best as we could. So we went through an organizational transformation at the end of the Active Living by Design program. We went through a strategic planning process, laid out the long-term vision that I had showed you on a previous slide for the Upper Valley Trails Alliance. We also really changed our definition of what a trail is. Anyone who's listening and anyone that we as an organization engage with, they may have a different feeling of what their perfect trail is. I know for me, I always look for a 2-foot wide footpath in the woods with no, you can't see the roads and you can't see too many other people. But there are lots of people that really look at rail trails or sidewalks or paved bike paths as their trails. So in order to have an impact on the community in terms of developing more trails, we really had to change what our definition of a trail was. The Trails Alliance also started to hold community forums every 2 years to solicit feedback about what the community wanted and how could then the organization incorporate that into our goals and vision for the future. And the Trails Alliance did not drop the healthy aspects of trail use. Instead of being the primary focus, it became a goal. So there are a number of reasons why people use trails. Being out in the natural world, using muscle-powered transportation to get to work, going bird watching, solitude in nature, you name it. And but health is obviously one of those. And so we didn't drop that completely. We just incorporated it into a much larger list of goals of why we get trails on the ground. As Attila mentioned early in his presentation, Albuquerque Trails had heard about the prescription walking program from one of the physicians that was involved in the early part of Active Living by Design and the Upper Valley Trails Alliance. It had a similar implementation to the Albuquerque Trails prescription trails program. We did have posters and brochures in the waiting rooms and exam rooms. The physicians that were involved offered very detailed interviews between patients and physicians to really figure out what those either emotional, mental, or physical barriers were to getting outdoors. And of course, it did have a positive impact in the community for those that were a part of the program itself. Some of the issues for the implementation from the Trails Alliance perspective was that it was really only adopted by a small number of physicians in the medical institution and where it was implemented. And because of the small staff and lack of resources for the Upper Valley Trails Alliance, it never really took hold in the community the way that we had wanted it to. So we're so happy to hear about the success of the Albuquerque prescription walking program or prescription trails program and how it's been able to have a positive impact in that community. We didn't fully abandon it. It still is around here in the Upper Valley. It just never took hold the way that we had hoped that it would. Something that we did coming out of the Active Living by Design project was we developed a loop trail, which again connects our 4 major Upper Valley communities. It's a bike path that is signed and uses the safest existing infrastructure possible. It took 13 years to get a 17-mile loop signed and put on the ground, but we finally did, and it's being used by a number of Upper Valley residents for recreation as well as transportation purposes. And the really amazing thing is that once it was on the ground and people started using it, the communities through which the Upper Valley Loop Trail passes have started to make investments to rebuild infrastructure. So as roads are slated for redevelopment, they're being combined with, let's say, a sewage overflow project is also being combined with developing a separated paved pathway to make that road a safer way to bike for transportation and recreation purposes. I'm going to hand it over to Becky now, who's going to talk about some of our other programs that focus a little bit more on kids in the Upper Valley.
Hello. So last year we partnered with the Albuquerque School, which is a small elementary school in nearby Quechee, Vermont, and we partnered with them to do a Wolves on the Prowl after-school program with the goal to get kids outside, having fun hiking and exploring the woods right next to their school, just to get them outside and having fun and realizing that that is a worthwhile and fun after-school activity. We worked with them on a trail system on their properties, as well as building a pretty sophisticated bridge across a brook. The kids also worked on building winter shelters. You can see a picture of one of the kids there with a winter shelter. The kids had an absolute blast with the program, and clearly the benefits are many. The trail building, not only did it help create a great trail system right next to the school, but it also helped the kids develop their teamwork skills, as well as just expose them to the nature, again, right outside their school door. Another one of our partnerships is the Upper Valley Healthy Eating Active Living partnership, which is currently hosted by the Children's Hospital at Dartmouth-Hitchcock. Again, we partner with them on many different fronts. The partnership itself promotes 4-season physical activity and good nutrition with various programming. It was started off as a New Hampshire state-funded program. We were asked at one point to be a lead in the partnership, but our experience, as Russ mentioned, with the Active Living by Design grant and sort of the burden that placed on us in terms of management led us to ask that the Dartmouth-Hitchcock Medical Center actually house the program, but we are great partners with them and continue to be. The result is that we've partnered with them to engage in the things that they do best and that we do best, and it helps us create an efficiency of resources so that we can really focus on the programming that we do best. Some of the programs that the partnership has helped shape and fund are Trail Finder, which is a free online searchable trail database for the Upper Valley area, and it's one of our signature programs. Another program that we've partnered with UV Heal on is Story Walk, which is a program where stories are placed page by page on placards along a trail or a pathway. We've created 3 separate story walks, and they're available to be lent out to schools, preschools, daycares, any interested community members. They are a great way to get kids involved in exploring different trails and pathways, reading along the way, and we often encourage the kids to act out the stories. It's definitely a fun activity, fun family activity. Finally, the Passport to Winter Fun program is our signature activity incentive program, and I'll get into some more details now to tell you about that program. This program truly emphasizes the connection between health and physical activity for us. The goal is to encourage kids to be physically active and outside during, as Russ mentioned, the long Upper Valley winter months that have recently started. Got some snow today up here. So this is the 6th year of our program. We've reached nearly 20,000 students since we started. Last year, the program served about 4,000 kids in 29 area schools. And again, that's Vermont and New Hampshire, this Upper Valley area. The way we implement the program is we contact schools in the fall and confirm participation for the schools that have participated in the past, and hopefully sign up some new schools who haven't participated before. We are also contacted by schools and homeschooling programs who hear about our program and want to participate. So in early January, we start to visit schools, and I hold an assembly at the schools to present the program and get the kids excited about getting outside and active. It's often pretty goofy, and I feel silly, but it's great to see the kids get so excited about being active. So this is a pass-through program, meaning that we give the schools all the materials and information, and our job is to get the kids excited and sign up for the program. But the school is responsible for getting the messaging to the parents and encouraging the kids to participate for the duration of the program. And that's actually somewhat of a challenge for us because it's hard when we don't have direct contact with the families. So the passport itself that each child receives at the beginning of the program is modeled after a regular traveler's passport, but it's focused on a 30-day pathway through a winter landscape. And you can see these characters that are present throughout the passport that the kids seem to respond well to. For each day that a child is physically active for 60 minutes or more, they fill out a block along the path, and the kids can either draw a picture of the activity that they were involved in, or they can write it and describe what they've done for the day. So when the kids reach 10, 20, or 30 days of physical activity, they can redeem incentive rewards, and these are courtesy of local businesses who donate the prizes. And the rewards are aimed at getting the kids to try new activities in winter sports. They include things such as cross-country skiing or free skating for the entire family. So this coming year, we're hoping to make the passport available to over 4,500 elementary school students, and we'll begin implementing the program in January. So the kids have about 6 weeks to complete all 30 days of activity, so this allows for some days off or sickness or vacation. But we emphasize that it's really not that hard for the kids to fit the 60 minutes of activity into their day. The exercise can be indoors or outdoors. We, of course, really hope that the kids are going to be doing their activities outdoors. We say it can be easy as going out and sledding with your friends or building a snow fort, throwing snowballs at your brother or sister, just exploring their yard. But indoor activity does count as well, and as well as gym and recess at school. So when the kids reach 30 days of activity within that 6-week period, they receive a prize and are entered into a grand prize raffle. And in the past, the prizes have included things such as snowshoes or digital video cameras, so the kids can record their activities. They're very popular with the kids. So there's also an incentive for the kids to be active with their family members. And every day that a child is active with a family member, they can fill in a star on the box in their passport, and if they have 20 stars within the program period, they're entered into a grand prize drawing for the family. When the kids receive their passports, this is what the inside front cover looks like. They fill out and hand in the front flap, and they answer questions based on their current and the previous year's activity levels. And this pre-intervention data is very important because it gives us a baseline as to their activity levels. At the end of the 6-week period, the 6-week program, the kids fill out the back flap, and that details their activity levels at the end of the program. And so by comparing this post-intervention data to the baseline data that we collect at the beginning, we're able to really examine the efficacy of the program and to really check ourselves and see if this program is working, if we are getting kids more active. So the good news is it seems to be working. In 2011, the data from the school showed that a full 79% of the students who completed the program said they're more active after the program than before. And 95% of the students who completed the program said that at least half of their activity was outside, and they also increased their activity levels by 44 minutes a week. And we see those as huge improvements, and it's very encouraging. So this really shows us that activity-based incentives, which is the way that we modeled our program, are key to helping motivate children to increase their activity levels. So looking forward, the goals for us are to increase our participation and completion levels for the program. So the main goal for us in creating this program within UVTA and with our partners at UV Heal and our issue of students' decreased outdoor physical activity and the health issues that arise out of that. And the program does seem to motivate kids, and again, the goal with instilling healthy habits that ensure active living and physical activity throughout their adulthood are Our goal is to get kids while they're young to help them develop healthy habits that they'll have for their lifetime. And also because fewer students are participating in phys ed classes in school and are participating in fewer and fewer classes as they get older and move through the schooling system, we think that it's really crucial that the students establish these healthy, physically active lifestyles at this early age.
So just to wrap up, what does this all mean? So for an organization like the Upper Valley Trails Alliance, we're getting trails on the ground and getting people to use them and developing programs that encourage people to get outside, obviously leads to healthier communities and populations. We're also seeing something that we hoped would happen when we were founded as an organization, which is a greater community investment in trails and active transportation. Some specific examples of that are there are growing corporate health and wellness programs that provide incentives for their employees to get outside and to not just offer gym memberships, but offer organized hikes and different kinds of trail outings. Those businesses have also, we've seen an increase in their investment in their own local trails on their own campuses. There was a program that we were a partner in called Smart Commute, which encouraged businesses to offer incentives to their employees to bus and bike to work rather than driving by themselves. We've seen as towns renew their master plans that they're including areas for trails, recreation, and transportation. So finally, after implementing a series of successful programs and building trails, and the old adage, if you build it, they will come and use it, has shown to be very positive and successful here in the Upper Valley. And therefore, there's been a lot more investment in trails, which leads to healthier communities and populations. So with that said, I'm happy to hand it over to Judy Corwin, who I believe is in from Corvallis. And thanks. I look forward to any questions you may have.
Hello, I'm Judy Corwin from the Corvallis Clinic in Corvallis, Oregon. Are you able to see my screen okay?
Yes, we can.
Okay, so I'm going to talk to you about a program called Walk with the Doc, and I'm going to tell you that the program that I'm going to share with you is not nearly as formalized or evaluated as either of the two presenters so masterfully did before this presentation. And the good news about that is that if this is something that you want to do, it doesn't have to be totally formal. It can be fun and it can be easy to implement. Our medical group is a group of 80 physicians in the Mid-Willamette Valley of Oregon. It's a beautiful place to use. We're blessed with an abundance of bike trails and people who do like to get outdoors, and so we could take advantage of what is already here. And we started the Walk with the Doc program in 2003, 9 years ago. It started as an idea from our OBGYN physicians, and I do know that there is a Walk with the Doc, a more formal Walk with the Doc program that's promoted by the Cleveland Clinic, but I will say honestly we didn't know that that program existed when we started this in 2003, 9 years ago, and this was really only at their inception. The goal was really that our OBGYN doctors wanted their pregnant patients to get out and walk, and they wanted their excuse me, their patients who had just delivered babies to also feel comfortable getting out and walk. And they thought that the best way to do that would be to lead some walks. And so they chose the 2.6-mile Bald Hill Path that is in Corvallis, Oregon. And like I said, we have an abundance of walking paths and trails within our community, and we're really lucky about that. So I wanted to share some of the beauty and some of the photographs. The program goes in the summer from June until August, and the participants meet once a week with the physician, and they're led on the 2.6-mile trail, and they're encouraged to bring their pets and bring their strollers and bring their babies. Some of the beauty of the walk and the nature, it's a 45-minute walk. It passes through Oak Creek on the walking trail. And I'll show you a couple other pictures here a little bit later on where you can see some of the critters that they engage with along the way. One of the purposes for the walk to be developed was that physicians were modeling wellness behavior, and they felt no better way to encourage their patients to do this is if they agreed to lead the walk and do it themselves. One of the ways they enticed their patients to participate was that they made themselves available to ask and answer any question along the walk. So if there was a patient or an individual that wanted to ask a question and they didn't want to make an appointment to come in and see the doctor, they just wanted an opportunity to get a little bit of advice, here was the physician on the walking trail willing to talk to them about any subject and any matter. Of course, they really wanted to talk about women's health, and they wanted to encourage women to participate. And while most of the walkers are women, children and pets and spouses are all encouraged to come. And while this program is not overly formal, we do have people who have been walking in this program since it started 9 years ago, and they continue to walk, and they continue to ask every year, when's it going to start again, and please let me know because I want to be involved. So the sustainability of the program and the consistency has been one of the outcomes. At the same time, the physicians also offer advice. So they start the 45-minute walk with about 5 minutes where they gather the group of women together in the outdoors where they meet near Bald Hill, and there's ample parking there and a little bit of shelter and restroom. And they'll take 5 minutes to talk about some aspect of good health, whether it's having a good self-breast exam or the importance of good nutrition or the importance of getting out and getting exercise, whatever topic that they want to speak about for 5 minutes. And that's the opportunity to engage the participants in a little bit of conversation with the doctor, and then sometimes along the walk they'll continue and answer questions about the topic that they brought up, or they can deviate to any other topic about health and wellness that the patient may have. Along the way, in the beauty of the outdoors, and there are certainly a lot of exciting critters out there, everything from deer and bobcats to coyotes. Never had any problem as far as encounters are concerned. Walkers snack on berries and cherries and such that they can find along the way, and in August particularly, blackberries are just wonderful. As I said, the walk began in 2003, and it was a way for the physicians to encourage their pregnant patients and women to walk, and they have had a number of participants who have been either just delivered or are pregnant, and this is a good way for them to become healthy. We've promoted the walks through our marketing department, and the doctor's office is outdoors on Wednesday mornings, and created our, we call this lady Carey Corrales Clinic, Carey spelled C-A-R-E-Y, and developed some Walk with the Doc t-shirts, and she's kind of the symbol of getting our patients and participants out walking. We've had some cross promotions with our Benton County Health Department, and they will promote this walk in their August in Motion project. We've also had the Greenbelt Trust organization promoted through their publication, because the Greenbelt Trust promotes the takes care of the Bald Hill trails and walking area. We also will cross-promote it with a couple of our other programs within the Corvallis Clinic. We have a Project HER program, which is about breast cancer, help, education, and resources for breast cancer patients, and we will encourage those patients to participate in the Walk with the Doc program. When school is out, we get an influx of young students and children who will participate with their moms, particularly, to come out and walk. We usually have 8 to 12 walkers per session, and try and keep that going. And as I said, the numbers are not overly abundant from walk to walk, but the sustainability of the program has been wonderful. Here's just a few more pictures, some of our physicians, some of our regulars that are always out there, and moms with their babies. To entice patients to participate, every time we have a grand finale drawing at the very last walk of the summer, and all the doctors are present at that particular walk. They do share responsibilities from month to month. Sometimes they're not all present each week, but for the grand finale, that they are all present. And each time a walker comes and participates in the walk, their name goes into a drawing for the grand finale. And if they bring a friend to the walk, and the friend has to be a human friend, they will get an extra ticket into that grand finale drawing. And then at the end of the season, we gather after the last walk for the summer. There are bottled water and fruit for all the participants, and then we draw for a $100 gift certificate at one of the local sporting goods stores to, again, encourage them to participate, get active in whatever activity they wish. So that's really my presentation. I will tell you that our goal is to take this program and expand it from its summer, June to August time frame into something that goes all year round and involve more of our physicians beyond our OBGYN department, as well as our Parks department. So I enjoyed listening to the previous presentations as well to pick up some new ideas of how we might go beyond that. That being said, that's my presentation, and I will turn it back over to the group for questions.
Okay, great. Thank you very much for those presentations. We do have about 5 minutes left for some questions, and I've already received several, and so we will run through these. The first question, I got several people who asked this question or variation of it. A lot of medical offices are now using electronic medical records and including digital prescriptions. How do you factor prescription trails programs into the electronic medical records and files, as well as into the prescription process?
I can address that question. We actually have an electronic medical record in the clinic that I work in, and I have 2 options for the prescription. I can fill out the prescription trails one, and I can also enter a prescription into the electronic medical record, and it's sent to the front desk where it's printed. I personally prefer to use the handwritten one. I think there's something about the act of me taking a piece of paper and writing on it and handing someone something that I've handwritten that has value. I write out lots of instructions for my patients, and so I do prefer to use the handwritten, and then I just include in my note, my electronic medical record note in the plan, that I've given the patient a handwritten prescription.
All right, thank you. The next question is how are the outcomes of these walking programs being measured, and how effective are they?
Well, New Mexico's program is still in that process, trying to figure out the effectiveness of it. We had some earlier challenges with asking the patients to collect data on how often they're walking, was it making a difference or not. Some of the health programs were a little concerned about collecting that kind of data. We're still exploring opportunities with the UNM, University of New Mexico School of Public Health, to help us do more evaluations of the program. So I think the rest of us, it's still tough to have large numbers of physicians' offices or RNs or PAs, whoever, giving out prescriptions. I think we need more volume to help us get at the effectiveness answer.
This is Judy Corwin, if I might chime in. We don't evaluate our program in terms of numbers or health benefits. We know they're there. Our patients are walking with their feet and they're voting with their feet. And the kudos and the role model behavior that our physicians have received because they do this has been a great benefit and a great outcome. If we ever get to evaluating it, and I'm sure we will as we grow the program, I'm sure we'll see some of the benefits, but I don't think that there always has to be a number associated with the evaluation, as there can be just the pure benefit of being outdoors and what we already know about disease prevention because of it.
This is Russ Hirschler from the Trails Alliance. As Attila had mentioned, you know, we ran into a similar issue in terms of the volume of patients that were involved in the prescription walking program, making it quite difficult for the small number of physicians to really formally look at numbers and impact. A lot of anecdotal information said the program was very successful. That's one of the reasons why when we really made an investment in the Passport to Winter Fund program, we wanted to make sure we incorporated some aspect of pre- and post-intervention data collection, and then working with some of our research partners, we're able to come up with those numbers that Becky had shown on one of the previous slides. But we're also very lucky in that program, and that the sample size is quite large for a physical activity intervention program.
Okay, thank you. My next question is, what liability issues are there for doctors who prescribe walking or tell patients to go walk more, or for like the Alliance who's putting on these walking programs and other events?
I can speak a little bit to that. I can't speak to malpractice liability in terms of a physician writing a prescription for someone that walks on a trail and something happens. For the programs that we offer, they're voluntary. So the Passport program, if the student doesn't want to participate or their parents don't want them to participate, they just don't. So I think by them making the conscious choice to do it, it absolves any kind of liability from us as an organization. And for our events, we make everyone sign a waiver form and that kind of stuff. And schools also sign into this as well, so it's not like we're targeting students without working through the normal channels for schools in the education system. In terms of getting out on trails, we're kind of lucky in this region in that there's very limited liability for landowners and municipalities that offer trails for in the outdoors. Essentially, as long as there's not gross negligence by a landowner who has a trail or by a municipality that has a trail on public land, then those municipalities or private landowners are not held accountable for any injuries that would happen.
This is Judy Corwin. I would say that our program is purely voluntary, and so liability is not become an issue if people don't want to participate. That's a choice that they make, and since our physicians are not doing prescriptions and they're walking themselves, I don't know that malpractice would be an impact on that.
This is Tilla with the New Mexico program. I believe liability issue from the physicians hasn't surfaced as a topic, and our evaluation of the trail resource has been pretty specific, looking at all the cracks in sidewalks and making sure all those are fixed before we have a grade 1 trail designation that someone could be walking on. So we're looking at those topics, and in our case, all the resources are either a city or county facility, existing park or recreation infrastructure in the town that may be helping us a little bit. We're finding more of an issue of the maybe uncomfortable of prescribing physical activity in general versus where they go. There's a lot of programs out there now, just park prescriptions in general, where we're getting prescriptions to go out and be active in a park. So we're a little more tailored, a little more specific on identifying the specific resource and the condition of that resource.
Okay, thank you.
Donald, I really haven't had any issues related to liability come up. I certainly, it's not something that I've been concerned with when I was first given the prescription pads, and none of the other providers who I work with have raised concern about that. I think we're recommending something in the best interest of the patient, and certainly not recommending it for someone who would be at risk, and not recommending it for someone who may be unable to use common sense and be careful walking around a trail in a park. So I don't think that's a big issue.
Okay, I think we have time for one or two more questions. What strategy would you suggest people use if they wanted to reach out to healthcare providers to implement trail programs in their community?
Hi, this is Russ Hirschler from the Trails Alliance. Our experience has been that the number one most important thing is to find sort of the community spark plug or the change agent that's willing to take this on. Anyone who currently works or who has worked in the medical health the medical health profession, at times it can be a really difficult system to change. So finding those one or two people who have the ability and the patience and the energy to, again, be that, we call them spark plugs, is probably one of the most important things that we've experienced here.
This is Judy Corwin, and I would concur with what was just mentioned. One of the challenges that we're facing right now is that our OBGYN physicians were our spark plugs because they wanted to do that and they wanted to model behavior. We'd like to expand this program to include other physicians, but finding the right people, making it voluntary, and finding people that want to participate, you have to find the champions. Otherwise, it will not be sustaining. And we do get requests from outside groups like school groups and others who would like to perhaps start a program. We're looking at it, and it's starting. There's a balance between the contact from them administratively and how we can make this work, and then how do we approach and find the right providers that are willing to champion and participate. And we're actually in the process of trying to calculate that out right now.
Okay. Well, thank you very much. Unfortunately, that's all the time we have for discussion today. I'm sorry if we did not get to your question. The slides from today's presentation will be available later today at www.walkinginfo.org/webinars. Also, a recording and transcript of today's program will be available in a week or two. For updates when the recording and transcript are available, please follow us on Facebook Again, that's www.facebook.com/pedbike. Thank you again to our speakers, Attila Baladi, Linda McDonald, Russ Hirschler, Becky Lewandowski, and Judy Corwin. And thank you to all of you for attending today's PBIC webinar.